So I had a question.
Yes.
So you said you had, I'm just gonna move on.
Yes.
You had a contract for, do you have a contract for rental assistance and a contract for sober living? Did I miss?
Yes.
Okay, is that, who has the contract for rental assistance? Or are they not finished yet?
No, we have a contract with MCHSCoC for supporting folks who have eviction prevention risk needs and housing navigation related to that. And we have for move-in costs related to that. I could consider additional landlords, but I don't have any that we use on as frequent of a basis to address
So
that.
so the idea is that it's one of your larger landlords. And
Yes.
a client that is an SMI client that doesn't have other assistance available to them could access that. I got it. Okay.
And then what I was talking about before we got interrupted was we're in the process of budget modification to add some additional line items that aren't specifically housing related, but can be a barrier to individuals who are either at risk of eviction or moving into things like pet related costs, furniture moving costs, household sanitary type costs, and things of that nature. So we have not gotten approval for that, but I am hoping that we will, so we can move some of our unspent from prior years forward.
Is your deadline December 2027 or June?
I believe it is June.
Yeah, that isn't a ton of time, is it?
No, it's very much was meant to be a bridge funding stream until the BHSA comes into place, because the hope and expectation is the programs under BHSA will fulfill these needs, whether it's through a full service partnership, the housing components, or other. Last questions, and then I'll stop talking to you. Thank you.
This might be a stupid question, but how do we get people referred into any like eligibility? Like how are they getting entered or?
No, it's not a stupid question. It's actually a great question because it's not the easiest of pathways. So basically, if they're accessing services with behavioral health or substance use providers, their provider should know about it and should be accessing it on their behalf. Our mobile crisis has been one of our largest utilizers of it because they're coming into contact with the folks who, whether it's through mobile crisis or through core or door response, they're coming into contact with the folks who aren't connected with an existing service provider.
And so can they qualify either as a, you're saying 0 to 15, right? Because I'm working with families. So like whether I believe that the parent may have an underlying condition or the child is experiencing that, can they qualify as either?
That's full service partnership. It's a little bit different than bridge. There's no reason that they couldn't qualify if they qualify for both. If somebody needs behavioral health services, regardless, absolutely refer them for behavioral health services. And then for the housing component support, as they're assessed for meeting specialty mental health criteria for substance use treatment, their treatment providers are going to hopefully identify whether or not they meet criteria for full service partnership, bridge funding, if they don't have any other services. If you're absolutely not sure or you think somebody should qualify and their service provider doesn't know, you can always reach out to myself or to Dan Twyman, who's our manager over mobile crisis, because those are the more direct ways for the bridge housing funding. Full service partnership, they have to have been met criteria by their treatment provider as being that higher level of care, because that's a specialty mental health higher level of care for full service partnership. And then the expansion to substance use is coming in June.
Thanks.
Karen, could you just expand a little bit? How available is it? How many days a week does it work and hours a day?
Mobile crisis is 24/7. 24/7, 365. The access point is the same as the crisis line point. That was a state priority to not have multiple different lines. So it is still the 838 855-0404 crisis line number. The RCS crisis team goes through a DHCS required triage tool for mobile crisis. So not every request for a mobile crisis will necessarily be a dispatch if it's appropriate to be triaged on the phone, or if it's too high risk for a mobile crisis worker to go out without law enforcement, then there will be some triages with law enforcement. But it is 24/7, it is 365, so it is available on holidays. And it is county staff who respond during the day from 7:30 to 6:30, and it is RCS staff who respond the opposite hours in the evening. And so if there are any concerns, questions, details needed, again, myself and or Dan Twyman are the point people for that. And It is a new service, so there's a lot of confusion. There are definitely safety factors that we take into consideration. So there may be some calls that are handled by phone. There may be some calls that we do involve law enforcement if necessary. Goal of mobile crisis is if it is appropriate and safe for us to do so, we're going to be responding without law enforcement to handle a mental health emergency with a mental health professional.
But there's one team for the whole county.
We're not really operating in like the team, like there's these two people who are available from this hour to this hour. There are multiple people in behavioral health and there are multiple people in RCS who respond. And so they respond wherever necessary. So I have some days, Wednesdays, I'll have probably 3 to 4 people who are available to respond, and ideally in teams of 2 going out. But it doesn't necessarily mean the same 2 people will be available at the same time every day.
And so the majority of behavioral health and services that the county does are almost all contracted out.
The majority are of specialty mental health, yes. The substance use is a little bit different. It's probably the opposite because we're part of the regional model. Most of the outpatient and intensive outpatient substance use treatment is in county. We do have contractors, obviously, but if you look at the whole regional model, then it's a lot more diverse.
Karen, could you touch just real quick on what might be an emergency and what would, or who's just,
For mobile crisis,
you mentioned a request for mobile crisis. I'm assuming you're talking about somebody that's calling in on somebody else's behalf. And is there I don't know, is there a threshold?
yeah, so the Department of Healthcare Services actually created a triage tool for the implementation of mobile crisis. So there's a few things that they're going to ask as far as like, does the person want help? Are they willing and able to come in to get treatment? And so there's a yes, no around that. If the person's able to be talked through on the phone to stabilize their crisis, that's going to be least restrictive, least intrusive. So we're going to try to do that if that's possible and safe. If the person is too symptomatic or too uncooperative and unwilling to engage in that kind of intervention, then we're going to go to the next level. Okay, so is it safe for somebody to go out there? Are there weapons in the home? First and foremost, the question is usually, has the person who's needing crisis response done anything to harm themselves? Have they ingested anything? Is there anything to harm themselves in any way? And then later on in the questions that if we're looking at sending somebody out or sending a team of people out, we're looking at questions like, are there weapons in the home? Is there a history of criminal activity in the home? So there's some screening factors around what are we walking into when we walk into the home environment? Or is there a dog in the home? So that if there's things like that that might present a danger to the responder, we're not going to increase the risk of danger to everyone by adding elements that are unpredictable elements. So we're going to try to get as many of those questions answered through the Department of Healthcare Services approved and required triage tool. And then if the answers are, no, there's not enough safety risk to send emergency services and there's not enough safety risk to require law enforcement response, we're going to ideally have 2 people, but sometimes just 1 mobile crisis responder go to wherever they are, whether that's on the street, in their home, in the park, and try to engage with them. Sometimes they'll call first just to make sure, hey, I'm going to come out there, not to spook the person that they're responding to. Hi, this is who I am. I'm going to come out and talk to you. You had somebody who was concerned about your well-being. I'm going to try to come talk to you and see if we can resolve some of that. But yeah, occasionally we'll go with law enforcement if there's safety risks, either history at the location or the individual does have maybe some sort of dynamic. There have been cases where law enforcement asks us not to go because they believe response will increase danger to everyone on site. So that has been a factor that's come up. It's not our ideal outcome by any stretch of the imagination, but it is something that they have history on that we don't. And so we trust that knowledge and that expertise.
Thank you.
Anything else? I'm sorry, I talked way more than I think you.
No, I appreciate it, but we
Questions for Karen? This is really helpful. Thank you.
thanks for coming here.
Thank you.
On to updates from local jurisdictions. Megan, put it down to Mendocino.
You know, I don't have any updates specifically on housing issues. I did want to just let the group know that you're aware that the county has been, the Board of Supervisors has been focused on paying a lot of attention to the budget and the financial situation of the county. So that the Department of Social Services is feeling the impact of the hiring freeze. You're going to notice that there are fewer staff right now than we normally have. So some programs and some response times and some timelines are being impacted by that. So did want to just let people know that. We also are monitoring the effects of the federal shutdown pretty carefully with social services, CalFresh in particular. There doesn't appear to be an immediate threat to people's cash aid or CalWorks, but some of the impacts to CalFresh are still not clear depending on how long the shutdown will be going on. So again, not specific housing related, but just there's things are not all perfect. Perfectly in the department.
Megan. Going to the city of Ukiah.
It was here on Zoom, but we had to end that, so.
Recovering.
She's recovering.
Everybody else is scarred.
Shut down and it's gone.
I'm gonna edit the video, I'm gonna stop it, and then I'll combine this one, so it'll be a uniform.
Never happens.
Now it's there.
No, I would hope you're gonna
It's
edit
like
it.
to the side of it or something, like you had two different screens going on.
It's pretty different.
Like that we're talking
Anyway.
about everything, yeah.
Sorry.
Okay,
We do have Fort Bragg.
That tech.
Yes.
we'll move on to city of Fort Bragg.
I was going to speak this meeting on our Prop 47 program, but I feel that we can save that because I shared on it during the last reentry meeting. So for now, we can just move forward and we'll come back to it.
My bad. I'm sorry. That escaped my memory. I apologize.
Okay. Other updates from local jurisdictions?
From Willits, we're still working hard. We're focusing in on kind of what model we want to embrace for a navigation resource center with enhanced care management. That's our focus. We're still looking for a site, but we're getting closer. Our motel program is going really well. We have a private donor who is able to provide 2 rooms per night through the month, which is really awesome. And we're hoping for more. And we're also getting ready to apply for some grants. So we are moving slowly but forward.
Great, thank you.
I have an obvious question. How do we refer people to the hotel program?
They go through
Well, yeah.
Ruth Ann, to Ruth Ann, who's well known in that arena.
So how do we get contact information? I'm a Willits resident.
Yes.
So,
Actually, I have.
and we can share after the meeting, but I
Yeah,
think everybody might
Yeah,
want
because I wanted to ask you something else
Yeah,
too.
we have it.
I have one of the resource cards. Yeah, that's the other thing was we put resource cards with updated information on all resources available to folks, food and shelter and all kinds of services that we've been passing out at Brown Bag Lunch, everywhere, all over town. So, but I will get that for you.
For the daily meal.
Say that again?
What if they showed up for the daily meal? Could they get information there?
Yes.
Yes.
Yeah, so send them over to the,
Willard's Daily Bread,
thank you.
Monday through Thursday at St. Francis Church.
so let's exchange
And then-
information. too.
Yeah, but I would give
Everybody
you,
knows.
That's
yeah,
great.
I can get that to you.
That's
And,
perfect.
Our shower program has been cut in half, I'm sorry to say.
Maybe.
Yeah, we're working on that. But our showers right now are just Tuesday only, 2:30 to 4:30 for anybody that wants to come up. We have that available to the, in Willits at the St. Francis parking lot.
Their concern was it wasn't being used as much as they would have liked.
Yes.
But, anyway, it's kind of gone up and down.
Yeah.
Anyway, yes.
Okay, that's awesome.
Okay, we're gonna move on to standing committee report, starting with strategic plan.
So we had a useful and fun meeting, since our last meeting, the strategic planning committee met. We agreed to move forward with a contract with, RCAC. They were the people who facilitated our earlier stakeholder engagement meetings. So we will be entering in a contract with them to help facilitate the strategic planning process. The general model is going to be, we're going to have 2 strategic planning committees between now and March. But the bulk of our work around strategic planning is going to happen in an all-day retreat, which will be fun. To just knock the whole thing out in one big session, which will be in mid-March. So stay tuned for more details about that. Because I anticipate that we should be prepared for more than half of the board to attend. It'll be a Brown Act type meeting. But that's the model that we're going to use. So we're excited about that. I think we're in a good place to have a new strategic plan by next summer that will be different and great.
Any questions? Comments? All right, we'll move on to shelter and solutions. Veronica?
Our next meeting will be on November 12th. I know it says 1 PM, but it'll probably start around 1:15 since we have a lobby change. So I need to change that. So 1:15 PM. We're going to be talking about the funding that we've made available to our congregate shelters. I'm gonna have to look at the agenda items for the rest of it, but we've been doing some support for the Willett Shelter Action Group, as well as, or we haven't met in a while. Yeah, we haven't met since our last update, so I've reported everything from that committee, and we'll have more at our next meeting.
We'll move on to coordinated entry and discharge plan.
Coordinated entry work is going really strong right now. Myself, Joanne Brewer with RCS, and Tabitha Connell with Mendocino Coast Hospitality Center are participating in a HUD community of practice work group where we're collaborating with other COCs across the nation, mostly from the Midwest and the East Coast, that are also going to learn more in depth about coordinated entry, to build up some of our coordinated entry leadership. We've got a biweekly management team meeting that's going strong. We are looking at changing our prioritization. We're looking at replacing the VA SPDAT. We don't know with what, and we've got to build it locally. And so we're working on creating a survey, both of providers as well as recipients of services, participants, people experiencing homelessness or have lived expertise to get their perspective on what makes a person most vulnerable. Right now, the VI SPDAT measures how vulnerable a person is to death. But we can always look at vulnerable to what? Vulnerable to continuing being unsheltered, vulnerable to increased hospitalization. You know, there's different perspectives to have. And so we're having those conversations at the committee level, at the management level. We're really working hard to bring everyone that wants to be part of the conversation to the table. And we really want to bring that lived expertise to the table, but we also don't want to bring it and squander that attention and waste their time. So we've got to get it to a point where it's meaningful to bring in that input.
Yes, just one comment. Sonoma COC changed their assessment recently in September. And they ended up adding a tier system for the prioritization. And then they have family and youth,
family individuals. And it's family individuals, I'm blanking. And then seniors was the new area, but I know that they haven't. But yeah, they ended up changing and making it shorter, but also they did a lot of research and saw that the senior population, there's been a big increase. So they wanted to have their own subgroup to be able to prioritize. So, well. Yeah, any questions?
Questions, comments? All right. Community accountability?
So we intended to have a meeting today, but we've been having an issue with scheduling the appointment in enough time to adhere to the Brown Act. So we are going to reschedule it for either this week or early next week, Monday, and have enough time to have the agenda posted and have everyone be able to access the meeting as well. We have a few people who have lived experience who are excited to join the meeting that I've reached out to. Native, persons of color, veterans, they're all excited to be a part of it and have some of their own, I guess, expertise brought into it with their own lived experience and some of the agencies that have helped them or some of the barriers that they experience. So I'm excited.
I'm gonna add on to that.
Yes, please.
One of the things that I'd like to add to that agenda for the next meeting is the Adventist Health Howard Memorial. What did you call that, Janie, when you did the announcement earlier this beginning of the meeting?
The Avenues to Wellness.
Avenues to Wellness, doing a
Speaker
president
series.
speaker series, having someone attend that. I'd be happy to be the main speaker, but I think that the Community Accountability Committee, there may be somebody there that wants to join me with lived expertise, or maybe they want to have a specific focus on it, so that's the right committee to bring that to. That's
And
something.
then behavioral health and recovery services as well as part of that.
I don't know if we could do a joint presentation, that's a lot.
Well, yeah, at least speaking to those issues as, related to homelessness.
Maybe we should
You know
go,
what I mean?
we'll talk.
Yeah.
outside of it. But that's my thought is if the COC wants to have somebody to speak with that group, it would be this committee that would have that discussion and figure out what that would look like. Great, thank you.
Thanks, Veronica. We'll move on to HMIS performance measurement.
I do not have an update from the committee meeting because we did not have a quorum. We had Paul and I think somebody from RCS somewhere. It was Paul and somebody else. So we didn't have 3 people. We didn't have 3 organizations represented, so we could not meet. This is probably the most important committee that we have. I cannot stress enough that we need more members. The VA carries us because Diana comes and usually Kim Decker with the Nation's Finest comes, and that gives us a quorum, but they weren't able to attend for whatever reason. And so we weren't able to meet. It's imperative that our HMIS participating agencies have representation on that committee. So if you use HMIS and you don't know much about it, please reach out to me and I'll get you plugged in. If the date and time of the meeting doesn't work for you, we can explore changing that date and time. We meet on the 2nd Thursday of the month at 2:30 p.m. here in this room usually. Included in your packet is our September 2025 data completeness report, and we are working on getting you a report from the new data quality review platform that we have access to through Nutmeg Consulting. I just haven't had time to learn that process yet. And we're just keeping it on the agenda so that we remember that this committee is working with the COC board on making revisions to the HMIS policies and procedures manual. There's a long list of items ranging from changing county HHSA to County Department of Social Services, all the way to how do non-housing projects, what's their role in utilizing HMIS? Megan has reached out to the council about a specific topic regarding law enforcement utilization of HMIS. And I don't think we have an update yet.
No, I need to circle back with them. That has not been their priority, but I can, I need to reconnect with that on a timeline.
We're doing a lot of data quality improvements as we're gearing up for the LSA, the longitudinal systems analysis, as well as the annual HUD report on the system performance measures. So Paul Schmitz, with Nutmeg Consulting, is really helping with that. As you know, we're down to one HMIS administrator. And Amy's dealing with some significant medical issues. I heard today she's still in the hospital. She's been there for several days. So please be patient. Reach out to Paul Schmitz if you need anything. If I'm not responsive on the home team, you can email my regular one. But please remember we have the HMIS portal, the end user request for service. That portal is live and it is ready for people to start using. We don't have any, and it's been out for at least a month now. So if you have any issues, any questions, it's a really good way to get a quick response. Any questions? HMI?
We're gonna move on to ad hoc committee reports. Corey, Cal?
So the 2026 HIT and PIT count report. Our first meeting will be on October 22nd, 2025 at 1:15 p.m. I believe I think it's exclusively online because it's an ad hoc and it doesn't have to be held in person, but I might have a physical location. It'll be on the website. We'll have everything. I actually added in our agenda template next to E3 on your agenda, page 1, next to standing committee reports. I added a link to our meeting web page. So if you click there from the electronic version, it'll take you directly to the most current calendar with all of the events. That meeting should be on there, but if it's not, let me know. And after today, I might be a little more hesitant about what I actually publicly post if I don't absolutely have to. Megan, should I bring it up?
I can.
Okay.
Sure. So one of the first questions that this pit count committee is going to need to decide is whether or not we actually do a pit count in 2026.
Unsheltered.
An unsheltered pit count in 2026. So as a reminder, HUD requires these every other year. I think they require them in odd years. We just did the odd year in 2025. So we're not required to do a pit count in 2026. And for a number of compelling reasons, I would like the committee to consider not doing a pit count. I think Veronica just mentioned that her only remaining staff member is experiencing some medical issues. As I mentioned previously, filling positions of the county has been slow. Veronica used to have 3 staff. She has 1 right now who's on medical leave. And given the workload that the pit count is, I'm really looking at the priorities of the COC right now. We've got some really exciting work going on with coordinated entry. We've got some not so exciting work that may be on the horizon with loss of federal funding. And I just really think that we need to be clear about what our priorities are for staff time. And I know the pit count is a heavy lift for everybody. So we are going to ask this committee to consider that and then bring a recommendation to the COC board in the November meeting on whether or not to skip the pit part of the pit count in 2026.
We would still do a sheltered point in time count with using HMIS, except for our handful of non-HMIS participating projects like Project Sanctuary and the Youth Project. So it's actually a pretty quick and easy one to do. And then the housing inventory count is required every year, so we would still do that. No matter what.
FYI for now, if anyone has any strong feelings, let us know.
It used to be beneficial for us to do it every year. The COC board was the one that decided we'll do it every year. But things have kind of changed in that field, especially with the state. The state is actually using those numbers to measure progress. And the pit count is so unpredictable and then probably the most unreliable
Data point, yeah.
data point that we have that I don't think it's gonna hurt us not to have this my point.
But as Veronica pointed out, that is a decision for the COC board, so expect that on your November agenda.
So, I was able to present at the last reentry, meeting. We discussed the Prop 47, program that we have through partnership with City of Fort Bragg and Mendocino Coast Hospitality Center. For those who are not aware of the program, it is designed for a, almost considering respite housing. It's a 6-month program for people graduating inpatient treatment centers, both for mental health and substance use, who also have previous experience with either arrest, conviction, probation, some type of law enforcement contact. Right now we have almost full bed capacity. I think that we have 2 available beds. What that looks like for referrals are either making referrals of individuals who meet that criteria, either to a staff member with crew or a staff member with hospitality center. Jessica Fitch is the program manager for hospitality side, and Melissa Johnson is the program manager for cruise side. Either one of them is a good point of contact. Like I said, it's kind of an intensive program. So although it is housing, we've kind of ran through the kinks of our first participants. We've learned for the type of program it is, it's probably best that we have individuals that are eligible for a work track. So individuals that are applying for Social Security wouldn't be the best type of applicant because of the nature of the program, because it takes so long to apply for and obtain Social Security. People would time out before the program is finished, before they could really see progress and, obtain permanent housing. But we're working closely with hospitality. It's more so an employment program is the way I look at it. So individuals are receiving intense case management, being connected to vocational rehabilitationists, receiving mental health assessments, connecting to mental health providers if they're not already. And ultimately, once graduating from the program, as far as Prop 47, they would transition into Mendocino Coast Hospitality Center's transitional housing program if there's availability, and then graduating further into their own housing program. But it's a kind of a sustainability plan. Do you have anything to add, Paul?
No, that pretty much covers it.
A quick question. Do you guys receive referrals from or send referrals to the County General Assistance Program?
I don't know if we've received any referrals from GA, or do you mean make referrals to as far as to receive funding?
No, I'm thinking shared clients.
I know that there's some people who have applied for GA. I know that GA it's minimum income and it's more so guided towards the like incentives to obtain and look for housing as far as like getting around with bus passes and those types of things. I on my cruise side haven't, but I think that people with hospitalities, case managers have.
So in our other beds for transitional housing, a lot of those are paid for by GA. For sure. So yeah, we work pretty closely with them.
But I know the GA employment track, it's only a 90-day stay, it's only a 90-day eligibility, and they're always looking for like quick collaborations and, really to get people on their feet and stuff. So I was just thinking that might be another potential pool of applicants.
Does anyone else have any questions for the program?
You have to do your presentation anyway.
Right. And move on to board protocols, governments, we have a recommended action. Veronica, can you listen on that?
So ASR Applied Survey Research has provided us the final draft of the full executive report for the 2025 point in time count, both sheltered and unsheltered. It's right after, in your packet, right after the data report card, data completeness report card. So this is here for your approval. It follows the same format as the previous report. So that way there's consistency between the two. Changed pictures to try to identify some of our newer housing projects, especially the ones dedicated. We didn't get everybody in, but I think we did a good little update. We've got a section on long-term trends and homelessness. Where, that it was a wet day that day whenever we did this point in time count. So that kind of changes things. People hide more, other folks, a little bit more of a heart. Yeah, you can stay in my guest room. Yeah, you can go camp in the backyard so you won't be visible, those kind of things. So whenever it's wet outside, sometimes our numbers are impacted. This year we had a total of 440 unsheltered. That big, loud, like, here are our numbers. 440 unsheltered and a total of 636 was our count. We've got some good demographics. There was a couple of tribes that they didn't identify anyone in that tribal land. Doesn't mean that they weren't around that area, but those specific counts with Coyote Valley Band of Pomo Indians, Nollyville Pomo Nation, they didn't have the tribe. Are you able to, do you remember anything? This has been a long time.
Yeah, no,
We only had 2 parenting families.
yeah, I mean, it's, when you get to the small numbers, it's always a little bit like, there can be some big changes. I don't know, Blythe, did you want to speak to the family section?
Yeah,
Number is,
these numbers obviously, and we operate off the McKinney-Vento definition, which doesn't always align with our HUD definition, but those numbers are extraordinarily low from what I'm seeing in the school system. My numbers last year was our highest number of homeless in the county since I've been in this job 11 years. And that was 1,136 kids that were counted within the school districts. We had a high percentage of unsheltered, 15 unsheltered kiddos just in Fort Bragg area. When we did the count through the schools, trying to obtain the families on that pit count night was really hard because we have families that come into the office and maybe they're sharing what their living situation is. And so it's really hard to capture within that time frame. So we didn't have the response from a lot of the liaisons that I would have liked to have seen to be reflected in this report. But there's certainly a higher number of families with kids that are homeless that I don't believe are really captured in this every year. So
That's across the county, you're saying.
Mhm. Correct. With our highest percent being Covelo, and they were at 40% homeless identified throughout their number of kids that are enrolled in school out there. 40% of their student population is identified as homeless. It's the highest in the county.
Is there a way for Fort Bragg region to capture that information better?
I mean, it's all based on liaison identification, or if there's a family that you guys come across that have children, then notifying the school to make sure that they're captured in the CalPADS, like student information system. Yeah.
I think, I mean, as Blythe is pointing out, when you're driving around looking for homeless individuals, it's rare to see that morning. But that doesn't mean they're not sheltered somewhere else. So that's always been it's always been a challenge and continues to be a challenge. I mean, on page 10 of the report, no, page 7, this is my favorite chart. Excited about is me. But again, it shows that over the last 10 years, our unsheltered youth has gone down as the number of housing units I specifically identified for homeless individuals has gone up. So it's like a clear message there. As you build and identify more housing specifically for homeless individuals, your homeless rate goes down. So I'm trying to draw attention to that. Yeah, I think if there's no major comments or questions or problems or mistakes that you're noticing, let us know so we can get this kind of finally done. We usually do a press release. I'm not going to do anything flashy. We'll probably just literally send out the report. The report says everything we needed to say to the press. And then that usually generates some, a little bit of a flurry in the community of people having their opinions about the pay. So that may happen in the next.
So, a couple of things to, I hate to say it, just scanning.
Yeah, that's fine.
I think it's interesting that of the people who are surveyed, 46% say that they self-report that they have a disorder. And I think that just has to be, at some point, that really truly highlighted in terms of who is on the streets. And 37% say they have a substance abuse, along with a physical disability. And then when you actually look at how many people actually were able to qualify for disability payments, which also might help get them off the street, that's only about 22%.
Yeah.
So, I mean, somehow what we are doing with mental health clients it does not work. And some big systematic change seems like it has to happen. I don't know what that systematic change will look like, but I just think that definitely does. And then I know that Priest has been coming in and he did a lot of outreach because it was kind of sort of a dramatic increase in the number of Native Americans who are homeless, being that they, unless I'm wrong, in terms of demographics here in Mendocino County, they actually only consist of about 5.5% to 6%, and the same 37% are homeless. And it's always a shame for the number of Latinos and Hispanics that we have, that they are always such a low number of, in terms of who are homeless. And I don't know whether that's because of the family culture, that they always find a place to reside. But it is just, these are just kind of interesting stats to me to say, where do we need to look?
Yeah. Yes. I just wanted to indicate that I haven't seen any data for co-occurring, which would be like on 8. And it's supposed to show it shows the mental health disorder and the chronic illness and the physical disability and substance use, but co-occurring is it's very difficult, right?
we should have some sort of indication of those who are marked both of those, right? So the way that HUD has the reporting set up for the point in time count, there's not really a way to report that using their process. However, any other report that you have, it gives you that. It doesn't tell you necessarily this many people have substance use and physical disability, but it'll tell you this many people have just claimed one, this many people claimed two, this many people claimed three, and so on and so forth. And if we wanted to, we could dive into that and figure out what those are with dedicated reporting. That's why we hired Nutmeg Consulting, was to help us with that higher level of reporting. We potentially could get this, but it would have cost us a lot more money.
Yeah, no, it's
For
okay.
this specific.
Nutmeg is fine.
But we absolutely can, we have visibility on that.
Right. Because I'm curious to see if there is a connection between the co-occurring disorders with the physical differing abilities and how that also interplays with how long that they've been chronically homeless and unhoused on the street, right? And to see if those two kind of line up.
Yep, that would be interesting to look at.
We, I don't know how it is for other agencies inland or other folks that, you know, are doing this kind of work in this, but we look at those things periodically and just anecdotally to kind of see how people's self-report lines up with what we know about them, right? And what we find interestingly is that the mental health component really does kind of line up. And again, anecdotally, it seems like folks really underreport substance abuse, even when they're suffering from both. And I don't know, you know, and it's a self-report thing, so we just kind of.
So you're like noting, I have good reason to believe this person is struggling with substance use, but they're reporting no.
Well, when you're working with
Yeah,
somebody,
no, I can do that.
there's this barrier that's so obvious, right? They're getting picked up all the time, they're you know, they're coming in inebriated, they have to leave the shelter because they're causing so many problems, and you kind of go, you know, look at their thing, and they're working with somebody with mental health, or, you know, they have their own therapist somewhere, and you know, these questions are revisited and retreated, so you know, they still have the same answers, and I don't know what the ramifications are of that, but it's just interesting that folks have, and maybe it's a stigma thing. We've worked really hard, I think, as a system of care to reduce stigma on mental health. And I have found, just since I've been here, 15 years or so, folks have become more willing to deal with that issue, embrace those issues, be vocal about it, say I need help, and the substance abuse thing is sort of flatlined and.
Well, I always, I would say that we see that two causes, that's a really accurate description of it, and I pretty much make the assumption it's because people who have substance abuse issues, the model is, you know, no substance abuse, and they're not.
Right.
It's just like, yeah, exactly.
Whereas mental health treatment might, you get to talk to someone.
Right, exactly, not so bad.
No.
Oh, okay, if you have major comments, or again, if you notice an error, please let us know, so that we can get this report finally published and put on the website and sent out as a press release.
One change I am gonna do before we publish it is on page 9 of the report on figure 2. It's supposed to have the numbers in parentheses, the totals, not just the percentages. So it's 440 unsheltered and 196 sheltered. So I'll have the report updated to reflect that.
Okay.
So it's clear exactly what our count was this year.
Okay.
Are there any other edits that folks can see?
I like the pictures.
Yay, we think so. Nice.
I will just to give ourselves some, just the COC board, remind you that we didn't used to have a pretty report like this.
I know, it's
really nice. We used to just have kind of just the like chart that we had to submit to HUD, and it was very hard to really feel like it provided satisfying data. So I am happy to have this.
And then one last thing, I wish they could have did like a population to homelessness percentage reference, meaning we have all of the ethnicities indicated in here, or majority of, I wouldn't say all, amen, right? We're all mixed. But I would have really liked to see how these numbers correlate with the population.
Yeah.
Right? So that way you could see a true representation of the overall population for those specific races who are experiencing it. And that's how you get this population is 3 times or 5 times more likely to experience homelessness than such and such.
Right, you really can't see the disparity without having the population overall numbers.
Yeah. So that's the only thing. So
That is done in the AHAR.
AR.
That report that is annually submitted by HUD to Congress. That the point in time count is a component of, but not all of it. It'll actually draw down all of those details. This is a higher level report. But it will change.
Yeah. Nice.
But
it's state by state, not county.
well, they'll do it by COC. You can draw down the data by COC.
Yeah, it is.
Because we all submit it individually, so they have it. It's just not in their report to come.
I do think we need a motion to approve.
Do we want to approve it? Do we want to bring it back next month?
Well, the recommended action is to review and approve.
Yeah. So
Or we can approve with the changes you did.
Good job.
Motion to approve, the title of it. Our hit and time count with, the recommended changes, with the parentheses around the numbers.
Second.
Natalie,
yes, when I call your name, please let me know yes, no, or abstain to approving this report. Ashley,
Yes.
Live,
Yes.
Faith,
Yes.
Jeanette, Hannah. Joanne,
Yes.
Joanna,
Yes.
Judy,
Yes.
Teresa, yes. Alice had to step out. Denise,
Yes.
Dawn,
yes.
Janie,
Yes.
Karen,
Yes.
Matt,
Yes.
motion approved.
Great, thank you, Veronica. Now move on to funding, dates for the board.
And we try not to cry. Or get frustrated, so we'll see. Minor revisions to the HAP6 application are in process with the building. And we'll be bringing it to the COC board for approval for the actual MOU between the county and the COC at the November meeting. I'm gonna have to ask for an extension because applications are technically due back by October 28th, but that's okay. We'll make it work. And I'm actively working on the request for proposals to get round 6 funding procured for. And so we've done the first round of edits. I have a few things to add to it, and then it'll be ready to go to the next step towards publishing. So once that is out, I'll make sure that, you know, the full COC gets all of the information about it once it's published. things like that. That's all I have under HAP. At least right now. There's more, but that's all I have.
Questions, comments about HAP? If not, we'll move on to the COC.
Oh, I forgot. HAP 7 was approved by the governor. He signed the legislation. So there will be a HAP 7. We just don't know exactly what it's going to contain yet. We'll get additional information later. Moving on to the Continuum of Care program. I created a staff report for this group and added some resources. President Trump issued an executive order called Ending Crime and Disorder on America's Streets that has fundamentally changed how HUD sees the purpose of the Continuum of Care program. I've already reported to this group, not just the board, but the full membership at the July meeting, that HUD issued an email to all COCs, even though I didn't get it and had to go to our TA and be like, what are you talking about? They issued a notice saying that they intend to publish a 2025 COC NOFO. Despite the previous Congress approving it as a 2-year allocation. We've talked about in the past that this is potentially going to make other types of projects available, street outreach, transitional housing. But what those things failed to do was tell us where that money was going to come from for those expanded projects, because Congress has not allocated any new additional funding the way that they do in previous NOFOs when they roll out new activities. They have more new money for it. That did not happen. And on September 29th, Politico published an article that's linked in the electronic report that interviewed HUD SNAP's office, that's the office that oversees the COC program. They spoke under anonymity, but they said that HUD does intend to do a 2025 NOFO, and that it's going to put a cap on all permanent supportive housing projects. That cap is 30%. So if you're currently funded at 100%, you're going to lose 70% for transitional housing or street outreach. And your community is it's unclear whether that balance of that money could actually be reallocated within our community and retained, or if we're capped at the preliminary pro rata need, PPRN, that HUD determines each year. So there's a lot of questions because this has never happened before. And HUD is even denying that they're doing any of this, so they won't answer any questions. So it's all like conjecture based upon pieces of information that we're getting handed out little by little. One of the things that I learned when I was last week, I attended the National Human Services Data Consortium for MCHSCoC conference in Baltimore. It's the only HMIS conference that exists. And I learned from my peers there that some folks, the HUD's government shutdown contingency plan funding will continue for majority of projects for the first 30 days. And if the government shutdown goes to 31 days, then all contracts will be automatically renewed, whether they intend to do a NOFO or not.
Renewed?
Renewed.
Oh,
So
what day are we up to?
so I know there's a lot, like if this government shutdown prolongs, like I know it's bad for a lot of things, but it could potentially be really good for the COC program. So that's one little piece that I learned after I wrote this. I put in the specific numbers, and there's also a report in here that Teresa's going to speak to. But I also wanted to share under ESG, which is on the agenda as the next one, but I just kind of wanted to do them together. The California Department of Housing and Community Development, HCD, the staff that manages the Emergency Solutions Grant or ESG for Mendocino County's funding. They confirmed at the October 8th office hour session that they have no changes to the state ESG program at this time, but they are in active talks with HUD, with their attorneys, with, local state legislatures or federal legislators, about what the impacts are. And so if there are changes that HUD requires that come down, it'll be reflected in the standard agreements between HCD and the recipient, which for Mendocino County is Redwood Community Services. So they would edit that standard agreement to reflect any changes that come down through ESG. Because this is how the COC program is interpreting the executive order, but all programs are going to have to look at that and are looking at it. We have two immediate recommendations. The first is that our members advocate against this. I'll contact your senator, contact your representative, let them know your organization or you yourself, you're opposed to this. I'm going to let Teresa talk about what that could look like for our local programs. But I also, in your packet is a blog first is the actual notice from the SNAP's office about from July 3rd. And then I printed off the National Alliance to End Homelessness. Their CEO has a weekly blog, and on the 29th is the same day that the political article came out. They basically gave an overview and links on how to use their tools to advocate. So you can just kind of click there and it'll send an email automatically for you, and it helps with that. And so advocate. But then we also need to prepare for the potential 2025 NOFO. If that comes down, we're going to have a very short window to respond. The minimum that HUD has to give us is 30 days, but oftentimes in that NOFO, you're required to give a 30-day window for your applicants to respond to your local competition. So I don't know what that's going to look like. But I would like to request that we form an ad hoc funding recommendation committee to look at this and be prepared. There's a lot more information that I put into this report. Potential ways to fill gaps if this comes to fruition. Stole those from Teresa. She came up with them and contributed them. So please don't think that I came up with those off the top of my head, because that was Teresa. Okay, Teresa, I'm gonna let you take it over from here.
Yeah, so I guess it's important to note that right now, nothing from HUD is official, right? But we are basing this off of really, really reliable sources. And kind of nobody wants to be working for HUD right now, because what's happening is people are starting to leak information, right? And so that's kind of how this is all transpired. But so CDC holds the permanent supportive housing grant. And we get $2.2 million a year to provide rental assistance to people who are chronically homeless with a disability. If what is being said happens and they cut that budget by 70%, then it would be basically a cut from that program of about $1.5 million. So we would still be potentially eligible
for about $663,000. So we're going from 2.2 million to 663,000, which ultimately that would support about 43 households under the PSH program, under permanent supportive housing. We're currently housing 128 households approximately. So this funding would, in theory, be effective June 1st of 2026, which is really not that far away. We'd have to reduce that program by 85 households. So, so for right now, CDC, obviously, we are going to pause any new permanent supportive housing enrollments. We do have some people right now who have already been issued a certificate or voucher and are searching for a unit. We haven't pulled those certificates yet because, like I said, we haven't got any directive from HUD, right? So I don't want to do that yet, because with all this stuff that's happening, and if people can advocate, you know, you never know what's going to end up happening with it. But what we do need to probably do is, as a board or in a committee, is we need to probably start to develop some prioritization policies for who gets to stay on the program and whose rental assistance would potentially be terminated. And so we probably do need to start to discuss that. We also, right now, we do not have any turnover vouchers. So we do not have a place to transfer them to, like our housing choice voucher program. Because if you remember, the EHV program, which also housed homeless people, the funding is stopping for that. And so we have about 60 EHV households that we have this plan in place to potentially transfer to housing choice vouchers. We don't know if we're going to be able to do it yet because we're still waiting on Congress to pass the appropriations. Right now, government shut down. They're trying to figure out what's happening with the money. We're waiting for that to happen before we can really decide what happens with our voucher program and how many households we can kind of move over to that program. I don't think it's going to be a lot, to be honest with you. I'm hoping our budget at least stays the same and isn't dropped for our voucher program. So anyway, we're kind of dealing with this potential and the emergency housing voucher program, which are both housing people currently in permanent housing who were homeless when they came into those programs. There was some talk. So several of the budget proposals from both like the House and Senate included they wanted to increase funding for what they call tenant protection vouchers. And tenant protection vouchers are basically vouchers for people just like in these types of circumstances right here. And so both the Senate and the House in their budgets had that they wanted to increase the funding for tenant protection vouchers by about 38 million. We don't know if that's going to happen, but they were going to also include language in there to allow tenant protection vouchers to be used for emergency housing vouchers. Obviously, we're still waiting on the appropriations to be determined and all of that to kind of be put in place. But we will be applying for tenant protection vouchers. So there is this possibility of we can move some EHV households to tenant protection vouchers, and then potentially move some PSH households to regular housing choice vouchers. With that being said, it's not going to cover everybody. And with that being said, that could not potentially happen till fall of next year, right? So we're kind of in this really hard predicament. So
Teresa, when does the funding for HV, what the revised funding deadline? When do I think it's gonna run out? For
Yeah,
EHV?
I mean, wasn't it originally, the original promise was that EHVs would be funded through 2029 or something?
It was like 2030.
Okay, that's all
for
off the table.
Yeah, that's all, we are not going to receive any more funding for EHV. That is happening. We have enough funding to support rental assistance probably through like November of 2026.
Okay.
About a year left.
And if it could potentially be more depending on how soon I can transfer people. Right? So it could go longer if I could get like half the people off EHV, it could go for another year. So with that being said, we're trying to rack our brains with what to do with those households.
On a little bit of a lighter note.
Thank you.
You know, you've got to balance it. So I looked it up and the government shutdown began on the 1st. So Halloween Day.
That's their last chance.
I don't know if it's like a irony or whatnot, but it's kind of satirically funny in a sense. October 31st is when we should know if all HUD floodgates will open.
Yeah, maybe they're purposefully delaying because of it's politics.
Mm-hmm.
That's what I was thinking too. But we all get to wait and have the heart attack.
Yeah,
Vulnerable people.
these are our most vulnerable.
Yeah.
So. As far as the government shutdown, our permanent supportive housing grants fully executed fund through June 30th of 2026. So our funds remain accessible to us. So we don't expect an interruption because of the government shutdown for our PSH program. For our voucher programs, HUD has obligated the funds for rental assistance through December of 2025. So we don't expect any disruption to housing assistance payments during that time. If it happens to where it extends beyond December, we would be unable to make housing assistance payments, but we don't anticipate that to happen. So that's kind of a little bit of an update on that.
Teresa, do you notify people or do you try to keep this?
Do I know what?
Do you notify people?
The 5 people?
Notify.
Oh, I'm on what 5 people? Okay. Do we notify people? So is in regards to what? The government shutdown?
No, in
Okay.
terms of the actual, like EHV.
So we do.
That's ending.
So we do anticipate notifying people, but we don't yet. We're waiting for the appropriations to come out because once the money is distributed, we can determine what we're going to do and we can notify them of what exactly is going to happen. Not notify them of, oh, your assistance could be terminated because that's going to cause panic. So I'd rather notify when I know what's going to happen, whether it's termination or not, as opposed to before.
I would say, like messaging to clients, now is not a good time to lose your voucher. CBC does not have room to be, like you lose it, you probably aren't going to get it again. So,
Yeah.
I mean, this is the time for people to make sure they're paying their rent.
Yeah. We haven't issued vouchers for our voucher program since December of 2024, since we learned about the EHV program. So this entire year, we've just been letting our numbers fall in the hopes that we can transition EHV to HCV.
But I've also noticed that appeals are not being approved as much. I don't think the CDC, as we all understand, has the room to be really lenient with clients who are not doing their part.
So I think that's an important.
Yeah.
Yeah, because the majority of our clients, you know, of course, they're either sheltered by us or they have vouchers. Yes.
Or they may have come on and off voucher programs in the past and thought that kind of opportunity is going to continue to be available to them, and it's not. So we're being really clear, like, pay your portion, don't mess up. Okay, now in your housing situation, because we enjoyed a time during the pandemic, it seemed like, where there was just a lot of people were getting housing vouchers, there was a lot of support to.
It was awesome.
It was awesome.
We were all
And those-
collaborating,
Yeah.
housing people.
Yeah.
Well, we're our
Those days are over.
So our numbers.
Yeah.
Yeah, so we don't know what's going to happen. It's really kind of devastating news, but once we figure it out, we'll have to kind of collaborate and put some plans in place.
Speaking of which, we're gonna need a top committee to look at all of this. So Chair, I request that you create and you create an ad hoc class.
Yes.
Can I be on that?
Yes, you can. Yes. It'll just be whenever we start doing the local competition. We'll have to have you step out.
That's fine.
So absolutely, we need you. Anybody want to be part of that besides Teresa? Teresa, Joanne, anybody else?
Like,
Anyone else? Please. Okay, I'm also gonna send an email out, that way folks that weren't able to attend or got cut off.
not remember that.
Yeah. Thought about, yeah, but if you want to join, let me know, and I'll send an email out.
I would, let's try to do a hard sell to Angelica to be on that committee, because
Yeah.
I did notice, I mean, one of your suggestions is that projects where charging full rent because somebody has a voucher, but they're actually low income apartment buildings. I think clarity around that would be super important. I've already seen that happen at Plateau. Somebody lost their voucher and the building kept wanting to charge them full rent. And I'm like, I'm pretty sure they have to charge them the lower rent. So like, just making, if that's
nice for RCHDC to be.
Yeah.
Yeah.
So that everybody's on the same page around that early on, and Helica definitely knew the rules around that, so.
Well, yeah, and I mean, absolutely. I mean, for me, say somebody at Willow Terrace had a voucher and then they lost it or gave it up. I literally recalculated 30% of their income the first of the month following that change.
So they automatically get rental assistance, or
Willow
it depends on?
Terrace. Willow Terrace.
What about it, like Oar Creek or any of your other?
So, I mean, each project's a little bit different, right? Because depending on their funding
Yeah.
structure. So like Willow Terrace is 100% tax credit. So Willow Terrace is somewhere where we have the most flexibility because we literally can't charge anybody more than 30% of their income to live there. So when your share of cost for their voucher is like 342, more than likely their share of cost with me is like 330 something
Right.
dollars. And they don't need to keep that voucher unless they plan on leaving, right? So I've had numerous of our tenants there relinquish their vouchers because they have no intention on leaving. And it's not going to change their share of cost of rent whatsoever. It only changes their flexibility to be able to take it somewhere else. Right. And that's where a lot of them hold on to it, is because what if I want to relocate? But there's a lot of them who don't have a desire.
It'd be really interesting to figure out how many PSH people live in
Subsidized
subsidized housing already.
Do you not already know that?
I can pull the numbers for that. I think I did it once with Dan when I was asking him to provide.
I bet it would be
Better.
a not insignificant percentage.
No, I don't think that it would be insignificant either. And then if we could get like Danco involved, we could potentially, I mean, some of them could.
Yeah, I mean, not like HUD housing, right? Like
Right,
some of
it's not the
something like
same.
Gibson Court, you can't even have a voucher over there because it's built in subsidy, right?
Right.
So, I mean, it depends on which ones of our programs that we're running off of, but things like no place like home units, things like our tax credit units, there's more flexibility on those.
Is there flexibility with like waiting lists and providing preferences for potential chronically homeless, disability, PSH people that are at risk?
I wish,
No
but
way?
that's, no, I mean, the only time we don't have preference, our THCC doesn't do preferences whatsoever.
preferences.
But
But if they already live there. I mean, our CHTC does this smoothly. I think our for-profit housing developers who are doing in the nonprofit world, in the subsidized housing world, but they are for-profits. It's not happening that smoothly.
No,
And
for sure.
They, you know, for them, getting somebody with a voucher, they suddenly get to charge a lot more.
Oh, yeah.
Than they did before. So I think,
Yeah.
and Helica's expertise here would be really helpful.
yeah, I mean, it does help from an operating standpoint, right? It's that voucher, because we get the extra income, but there are places where that probably could be.
Of course, they want it, but if they can't have it anymore, we want the transition to happen smoothly.
It does, and then we just adjust it and move on with life, and it's not a big deal, yeah. We should, no, they should not still be getting charged full.
All right, yeah. Okay, we'll be right here in this room.
Thank you. Thank you. Does that fit again?